I'm going to flip over as we're talking about local wound care. I'm going to go over to the foams. There are a number of foams, and again, all of the companies that make bandages make foams. This one in particular is interesting because of its shape. Now, this is an old one, so it should be white, but for demonstration purposes, it's turned a little yellow. But the nice part about this is when you take it off, if you're under a breast or under an arm, because it has silicone on the inside of it, it sticks.
So would you still need to adhere this with tape or
A lot of people, unless they're wearing a snug shirt that's going to keep it in place, a lot of people prefer to tape it, but you can tell.
Mm-hmm. It sticks very well.
So, but it just with everyday movement, you might find that you might want to just put a piece of tape to hold it in place. Or if you're wearing a t-shirt and it's snug, you wouldn't have to do anything.
Oh, great.
Okay. So then there are other foams that are, this is all there are other foams that have silicone backing to them. This is one company's foam and another company's foam. Again, you can see I have different shapes and sizes of these foams. Searching on the internet and simply typing in foams, it will show you everything that you ever wanted to know about foams. These again have silicone backings on them like the tape. So I will use this on your underarm. These are a little bit more expensive, so they run in around the $20 mark. The beauty of the foams is that they are intended to absorb a fair amount of moisture. So where with the Inidine, if you've got a lot of moisture coming out of it and it changes color within 24 hours, you need to change it. Where with the foams, you can wear it for 2 days, 3 days, depending on how much moisture you have coming out. Now I've used a small one on you there, but if you might want to use a larger size, do you want to take that one off?
Can't see it. Okay.
How is that coming off?
That's good. And you know what, to lower your arm with it on, it's very gentle. It's not digging into anything.
Do you want to try this one, which is a little larger?
Sure.
This is like going shopping without going outside, isn't it?
Kind of. I do have a question.
Yes.
If your wound is, say, up in the corner of the armpit, are there tricks to get dressings to fit there?
I would put it on in a diamond shape.
Oh, that does feel good, and it doesn't really pull too much.
So I put it on in a diamond shape. And the other thing is, if you're wearing a lot of dressings and a lot of tape, if you alter the way you put the dressing on, the shape of the dressing, so one time put it on square and the next time put it on in a diamond shape, then your the skin around the edge of the dressing is given a breather. You're not always irritating the same area.
Right. Perfect. Great. Thanks.
Okay.
That's really helpful. That's where mine usually are, kind of in that little
it's
spot
just in that
corner.
spot, so you can see how I've put it on, and you can even bring it up a little higher on the diamond shape on your arm. I just didn't aim too well. Okay, you can take that one up. Now this this particular company has come up with a post-op silicone dressing. This is more expensive than is their dressing that you've just taken off, Stephanie. So it's probably kind of in the $15 to $20 range. However, if I can get this on right, it comes in squares and it comes in oblong. It's mainly meant to go over sutures. The beauty of this, and I actually learned this from a patient, is if you have these, I learned with somebody, I should call you patient, I should call you a person with HS, okay? The beauty of this, if you don't mind, is that she had, again, in the groin, the HS, and this fits just nicely in that area. And what you can do is cut off this area so that it goes around the pulley parts. So it's not sticking to the hair.
Right.
So, I'm not gonna put that on there, because you didn't wear your swimsuit.
I wasn't
What can you
prepared to
say?
mold my swimsuit today.
I know. So when you're putting this on, this is a little bit more delicate to put on because it will, if you take all of the backing off, it will roll back on itself. Okay, so we're gonna do this up here where yours usually come. And so you take the initial backing off and then you take one end off. Sorry, my hand's probably in the way. And then you take the other end off. And this, because of the way they've designed the foam, can be worn for 3 to 5 days.
Oh, that's great. Long wear's great.
Yeah. Well, then it doesn't make it quite so expensive.
Yes, for sure.
You know, so it's all about the cost. How does that one feel?
This one feels great too. I think that all of the ones with a bit of a larger tape, but the gentle tape hold much better.
Much better, yeah. And it's sometimes if you want to try these, and Lord knows they're expensive, so you may not want to get a lot of them, but if you want to just try them and try the different company ones, some people like certain ones better than they like the others. Okay.